Hi, this is Brian Schiff with Functionally Fit. In this column, I'm going to review an exercise that's really great for overhead athletes or anyone who's struggling with altered kinematics in the glenohumeral joint, some scapular dyskinesia, poor movement patterning. A lot of your overhead athletes that lift, throw, or do repetitive things can benefit from this pulling exercise. It's going to really promote improved scapular alignment, activation, really working on that posterior shoulder, posterior chain, if you will. So I'm going to show it on a free motion machine with two separate handles. Essentially what we're going to do is position the client with the feet about shoulder width apart. We're going to have soft knees, nice bend there. We're also going to have them activate the transverse abdominus. And then we're going to start at shoulder height. Okay, elbows will be locked nice and straight. Once they're in alignment, you may want to have them do a little bit of an active chin tuck or cervical retraction so they're not too far forward as well. But I'm going to cue them to basically depress their scapula or press their shoulder blades down. A lot of people will want to ride up and be in this elevated upper trap dominant position. So first cue is to depress the scapula. Once we're in that good position, we feel comfortable about their alignment, we're going to ask them to pull down to the hips, pause there, and then we're back up under control to shoulder height. We're just going to pull, nice and controlled, up to shoulder height. We have to remind them to stay depressed. They may get fatigued, they may want to let out of that position, so that's an important cue. So the goal is just alignment and pulling. If we want to progress that a bit, we can go more to a unilateral approach or an alternate arm pull. So now they're staying stable, and we've got a reciprocal pattern to work on. So it's a really nice way to emphasize good alignment in an athletic position. We can work on core, contracting, and staying kind of engaged throughout the movement. And we're really just working on pulling. We're getting scapular compression, we're getting some work. You're getting some tricep work, you're getting some lat work, some work on your teres major. But it's a great way to help them engage and work on depression of that scapula. So often we're up. And it's also not going to put any excessive stress on the rotator cuff, so it's a good alternative exercise if they're uncomfortable doing pull downs or pulling from that overhead plane. So you can take advantage of that. If you don't have access to two moving arms and you just have a cable column unit, you can certainly do the same exercise with a straight bar. Same alignment would apply. You're just now going to pull with one straight bar, but you're working on those same cues. So great exercise can be used in terms of corrective exercise or just a part of your normal upper body strengthening program.